Hello, Mr. President. Thank you for allowing us all to participate in this bipartisan forum on healthcare reform. Today, I will be addressing the federal budget. Throughout this forum, I've heard Medicare being mentioned as a contributor to the federal budget deficit. It's true that many of the elderly patients are enrolled in Medicare, and I know we have a lot of ongoing processes to decrease Medicare waste and fraud. But I've also come across in reading for our required text that many patients accrue most of their Medicare spending in the last year of their life. And most often these are terminally ill patients, and in the last 2 months, more than 60% of that budget, Medicare budget, goes to end-of-life care. One of my suggestions is to utilize hospice to help alleviate some of this cost and decrease unnecessary spending for end-of-life care. And research supports using hospice because many of the families are highly satisfied with the care, more than they would be as in a hospital setting or a nursing home setting. And also research shows that there is a decrease in spending when using hospice for end-of-life care. I would also suggest educating patients on the use of hospice because, I've heard other people mention in their debates that frequent ER usage is also driving up our medical expenses. And I know this is true with CHF patients and COPD. Many times they are in a revolving door through the ERs for CHF exacerbations and COPD exacerbations, when many of these illnesses can be managed in the home setting with hospice care. That would reduce the amount of unnecessary ER visits, and that would help to drive down spending, especially with Medicare patients. In this class, I have learned that there is power in numbers, especially in regards to the nursing organizations. Most recently, with the emergence of Ebola in the United States, when the nursing organizations came together to speak up on behalf of the nurses and healthcare workers and alert the public and the government that there was a lack of appropriate personal protective equipment. And they spoke up to just help improve the overall situation and to take some of that blame off of the nurses and make sure that the hospitals were doing their job to provide proper training and also proper equipment. And so I learned that the nursing organizations, they not only help with policy, but they can also come to the aid during situations where we might need a stronger voice to speak on behalf of those whose voices may not be heard. Thank you for everything, Dr. Arterberry, and I really enjoyed the class.